Hi everyone, welcome back to RN NCLEX Desk, and today we are looking at the cardiovascular system review in NCLEX, and the topic under this system that we're looking at is heart failure. So what is heart failure? Heart failure is when the heart muscle is too weak or too stiff to pump blood effectively. This means oxygen and nutrients aren't reaching the body the way they should. For NCLEX, you need to know the difference between left-sided and right-sided heart failure, the common signs and symptoms, as well as priority interventions. So let's look at the pathophysiology of heart failure. And when I say pathophysiology, I mean what's happening in the body when a person has heart failure. So when the pump isn't working, that is the heart, blood backs up. Where it backs up depends on which side is failing. So let's look at left-sided heart failure. In left-sided heart failure, the left ventricle can't pump blood forward into the body. Blood backs up into the lungs, and this can lead to pulmonary congestion. So when there is pulmonary congestion, you will see signs and symptoms such as crackles, shortness of breath, orthopnea, and orthopnea is when the person has trouble breathing while lying down. Also, the person is going to be coughing, and the person will also have frothy sputum. On the other side, let's look at right-sided heart failure. So this happens when the right ventricle can't pump blood into the lungs, right? So blood backs up into the systemic circulation. So in right-sided heart failure, the blood that is coming from the rest of the body backs up, and this results in peripheral edema. So you will see swelling in the lower extremities like the legs. You will also see jugular vein distension. Person will have ascites. That's when there's edema in the abdominal space and the tummy looks very big. The person will also have hepatomegaly, and that is liver enlargement. Okay, so one mnemonic that I can give you to help you to remember which heart failure comes with which symptoms. Just remember left for lungs, and that means blood coming from the lungs is backed up. With right-sided heart failure, just remember right for rest of body. That means blood coming from the rest of the body is backed up. Can you remember that? I'm sure you can. So let's look at the signs and symptoms. What you'll see in the patients. So for left-sided heart failure, as I mentioned before, you'll see dyspnea, and this is difficulty breathing. You'll also see crackles in lungs. Also orthopnea, the person, when they lie flat, they have problems breathing. And the person will more likely have frothy pink sputum. And this frothy pink sputum happens when the case is more severe, like when the patient has pulmonary edema. The person will also be fatigued, meaning they're tired, because blood is backed up coming from the lungs. On the other hand, for right-sided heart failure, the person will have peripheral edema where swelling in the legs and ankles will be visible. JVD, which is jugular vein distension, you will see neck vein distension. Also ascites, which is fluid in the belly. Weight gain also is one of them. This is fluid retention. Person begins to gain weight. The person will have fluid retention. Enlarged liver or spleen is another one. And this is because with right-sided heart failure, blood coming from the rest of the body is backed up. So what are the diagnostic tests that we can use to help confirm these issues? First is the brain natriuretic peptide. This is usually elevated in heart failure, so this test will be done to help confirm. Chest x-ray. What the chest x-ray will show is that there's an enlarged heart and pulmonary congestion. Echocardiogram. Echocardiogram measures ejection fraction, and the normal ejection fraction is from 55 to 70. This range may vary by institution. So what the ejection fraction is showing is that after the heart has pumped the blood out into the body in one heartbeat, if what is left back in the ventricular chamber is way past 55 and above, it means that the patient does have heart failure. However, if what is left back in the ventricular chamber is less than 55, that means that is an acceptable level of ejection fraction. So that's why I say the normal range is from 55 to 70. Let's look at medications, and you have to know these medications for NCLEX, medications that are used in patients with heart failure. The first ones are the diuretics, for example, Lasix. Lasix helps to reduce fluid overload, which can in turn lead to decreased edema and crackles. So you also have to watch for hypokalemia, which is low potassium when using Lasix, because the patient is likely to lose potassium through the urine, because Lasix is a loop diuretic, so it causes the patient to urinate a lot. AC inhibitors, example lisinopril or enalapril, what these medications do are they reduce blood pressure and afterload. The side effects of taking these are dry cough, angioedema, and hyperkalemia. So if you're not familiar with these medications, you can go back to my first video, NCLEX medications that you need to know. So this video will show you the medication categories and their action and the side effects. Okay, so we're moving on to beta blockers, such as carvedilol, metoprolol. These medications slow the heart rate and allow the heart to rest. Don't give this medication if the heart rate is less than 60 or the patient is in acute worsening heart failure. The next one is digoxin. Digoxin improves contractility of the heartbeat. That means it makes the heartbeat much stronger, but it also slows the heartbeat as well. So you must also know the toxicity signs of digoxin when the patient is on digoxin. And remember, we say that the toxicity signs are visual changes. The patient may see yellow or green halos, and also arrhythmia is one of the toxicity signs. Also, when giving digoxin, remember to check the apical pulse for 1 full minute and hold the medication if the heart rate is less than 60. So one tip with these medication is always link the medication with the effect and what to monitor for. So if you know that these medications have an effect on the heart and the blood pressure, it will give you an idea of what vital signs to monitor for. So you got to monitor the blood pressure as well as the heart rate. So what are our nursing interventions? What is the nurse going to do to take care of this patient with heart failure? What is the nurse's job in managing a patient with heart failure? So one of them is daily weights, and this is one of the most accurate way to measure fluid status. Also, strict intake and output charting is to be done. So whatever the patient drinks, that is to be charted. Whatever the patient excretes out of the body, that is to be charted, whether it be urine, whether it be liquid stools, or whether it be vomitus. Any liquid fluid that is coming from the patient's body is to be charted. Fluid and sodium restriction. These patients are usually on fluid restriction as well. So you will see the doctor write a fluid restriction, for example, 1 liters for the 24 hours. And these are just examples. The next one is to elevate the head of the bed for easier breathing. Also, monitor oxygen saturation and give oxygen if needed. Also, teach the patient to rest and pace activities or group activities so that they don't get tired too quickly and put too much work on the heart. So, NCLEX loves daily weights, so ensure that you don't forget that daily weights are to be done for the patient. And remember that 1 kilogram weight gain is also equivalent to 1 liters of fluid retained. Okay, so what are we going to teach our patients? Number 1, diet. Low sodium, no canned foods, no processed foods. In terms of liquids, as I said before, liquid restrictions are going to be in effect. May need restriction if it is severe, right? Daily weights. For daily weights, the person must be in the same clothes and using the same scale and at the same time of day. So when do we call the doctor? We call the doctor if the patient has gained 2 to 3 pounds in one day or 5 pounds in 1 week. Also, you inform the doctor if the patient has significant increased swelling. And also if the patient has shortness of breath at rest. Let's look at an NCLEX question. So the question is, the nurse is caring for a patient with heart failure. Which finding is most concerning? A, 2+ edema in the ankles. B, patient reports dry cough. C, weight gain of 3 pounds in 24 hours. D, patient reports fatigue when walking to the bathroom. What is your answer? So our answer is C, sudden weight gain of 3 pounds in 24 hours, because this could be an indication of fluid overload. And when there's full fluid overload, the patient is at risk for pulmonary edema. Pulmonary edema has to do with the lungs. So, this is a priority action that you need to deal with so that the patient's breathing is not further compromised. So let's wrap up. Heart failure is all about recognizing the difference between the left and right heart failure. Knowing the medications and understanding priority actions. Always think safety, ABC, and Maslow's when prioritizing. So that's the end of our cardiovascular system review, folks, and that is heart failure. That is our review for heart failure, a simple and quick review. And if you have any questions, you can put it in the comments. If you need to study the medications for heart failure, you can go to the first video and look at the different categories of medications to get yourselves familiar with them. So that's all. See you in the next video.